Right, good evening, everybody. My name's Councillor Webb, and I'm chairing the meeting this evening. Obviously, normally Councillor Baker would be chairing, but unfortunately she can't be here tonight, and she has sent her apologies. Also, Councillor Orrell has sent his apologies, and he is being substituted by Councillor Daubney. And Councillor Barker is currently not here, but I hope he's on his way. I'll start this meeting of the Children Education Communities Policy and Scrutiny Committee by asking, does anyone have any declarations of interest? No? Okay, thank you. Just to be clear, there's no minutes for me to sign off because we did a lot of that last week at our meeting last week, and we haven't had the minutes for last week's meeting yet, which is absolutely fine. Item 2 is public participation, and we haven't had any notification of anybody who'd like to talk to us. So there we are. And then what I'd like to do is just swap things around slightly and just look at item 6 first, which is the Finance First Quarter Monitoring Report. And the reason I'm doing this is, one, I think it does set the scene a little bit in terms of the finances. I think it's useful to have that in our minds. And also we did spend a lot of time scrutinising this only a week ago. And I don't think huge amounts has changed in that week. So I was just wondering if I could invite Richard Hartle, if you could just introduce yourself, Richard, and maybe just introduce what we've got in front of us here at item 6. Thank you.
Okay, thank you, Chair. Yes, I'm Richard Hartle. I'm the Finance Manager for Children's Services at the Council. I think I'm just here to give you an update on the financial position in Children's Services. I think my understanding is that you had quite a detailed discussion around a couple of papers from Maxine, one of the ADs, and from Sophie Wales, the other AD, in the 2 specific areas, but without the specific figures in terms of where we were at that point in the year. So what you've got in front of you at agenda item 6 is the financial position just for the Children's Services aspect of the People's Directorate. So that includes Children's Specialist Services, so Children's Social Care, includes Education and Skills, and then also the sort of school funding aspect of the Directorate's budget. So this is information that was discussed at the executive meeting in August, so as part of the overall council monitor for Q1. So the figures that were in there in this report were summarised in that overall executive paper, and I think the narrative pretty much is the same narrative that was in that executive paper. So this is just the position we were at Q1. Clearly, where we are in the financial year, we're just at the end of September, so we are at the moment preparing the Q2 position, which would go to executive in November and possibly come back to this committee at some point for further scrutiny, if that's what you wished. So the analysis at page 67, table 1, basically just sets out the position that we're looking at Q1, and that's about a £6.6 million projected overspend, which I think is, although we didn't have the figures last week, it's probably in line with what expectations were in terms of the information that was provided by the 2 ADs and the director at that time. Clearly, you'll see the vast majority of that overspend is within Children's Specialist Services and within Children's Social Care. And the main issues driving that, again, are the things you discussed in a lot of detail last week. So around the number of looked after children that we've got that is in excess of the number that's budgeted for, and also agency staffing within that area. And then within Education and Skills, about a £600,000 variation projected, and the majority of that is within the home to school transport budgets, particularly around the SEN transport. And again, I think we went into that in quite a bit of detail in terms of what's happening there and the actions that the Directorate's taking to try and help mitigate that as far as it can. So I'll stop there and open up for comments or questions or clarifications.
Thank you, Richard. Councillor Heaton.
Thanks. Just a very quick one. Point 12, where it's talking about the staffing overspends in the MASH and assessment teams. And it says mainly due to vacancies being covered by temporary and agency staffing. Obviously, yeah, we're going to have some flex, between time. But let's say in a hypothetical situation, 100% of those were covered. How much of that overspend would be eliminated at that point?
So wherever we've got vacancies and we're covering them by agency staff, that will always create a budget pressure for us because we never budget for agency cover. We always budget for permanent employees. We don't budget for any vacancy factor, so that the 100% of the budget is there for the full year. So I think in that particular one, there are also, as well as the vacancies being covered by agency staffing, I think there may well be one or two actual additional posts that are above the budgeted establishment that will be creating some of that pressure. I think that's probably less than, in this monitor, probably less than about 50k in that particular area. So about $500,000 of that will be the agency staffing. And that's the thing that's really hitting us hard at the moment financially, is the additional cost of those agency staff rather than the total number of staff that we've got, if that helps.
Yeah, that is one of the things we talked about last week at length. So yeah, thanks very much.
Thank you. Does anyone else have any comments, questions? Councillor Fenton.
Thank you, Chair. Just a quick question on paragraph 18. Cost pressure arising from an increase in pupil numbers at 2 schools and accompanying homeschool transport costs. I just wondered is that likely to be a trend that we'll see a persistent trend going forward in terms of either an increasing numbers or an increasing number of pupils choosing to go to those 2 schools, which presumably are in their catchment but are a sufficient distance to trigger the transport eligibility?
Yeah, the transport to both of those schools, both Huntington and Fulford, it brings children in from the village catchments. So Strensall and Dunnington, Elvington, Weldrake with Thornaby. It's those sort of areas that the children are eligible for statutory home to school transport. We have got for the next 3 years a bulge in secondary numbers, which is working its way through. So we knew that demographic trend was happening because it had happened in the primary schools and was gradually moving through. These are both 2 schools which have historically been popular and oversubscribed. So people do move into the catchment of these 2 schools because of their reputation. So they've always been very, very popular. There is predicted to be, once that bulge has gone through, a small decrease in the demographic. But obviously, the big variable in the case of Fulford is Germany Beck and what happens in terms of any additional numbers that come from that development. At the moment, we're not predicting that will be outside of the predictions that we made through school place planning. So we're not really feeling that it's going to see a massive increase in transport that hasn't been planned for over the next few years.
Councillor Fitzpatrick.
Just a comment really, rather than questions, because we did look at this and we did say last week that we recognise we need more money. I looked at Councillor Cuthbert's and I know we can't magic money from somewhere, but you know, we did make comments about needing more money in this area. Just to say, Maxine, that I do recognise, and I think we all recognise that you have worked very hard over quite a period of time on homeschool transport. I mean, it's been discussed ever since I've been a councillor for the last sort of, with a gap for more than 10 years. It's always been difficult. It's interesting that we're talking about the changes in legislation to allow education and care plans 19 to 25 as well, you know, is a factor in there as well, isn't it? So, okay, so yeah, just recognising that you and your team are working hard on that.
Thank you. And Councillor Cuthbertson, who's the executive member for Children and Young People, do you want to have a word about this?
Thank you very much, Chair. I'd just like to come back on 1 or 2 of the points that have just been raised. First of all, the reason for replacing MASH staff on a temporary basis with agency staff is that MASH is the primary entry point into the care system. And that means that that's where the pressure comes. And if you've got an early help situation that needs attention in what would normally be received in the MASH, then you've got to fill those vacancies very quickly. And in a sense, that's characteristic of many of the vacancies in our social work system. Maxine's just talked about the bulge in the school age population, which is coming up. And for those of you who take an interest in decision sessions, you'll know that there's some funding to be decided for Millthorpe and for, sorry, the other ones. Yes, and Manor, sorry, which is actually down almost purely to this bulge, whereas the Huntington question is interesting due to the difference in the number of school-aged children who require transport to and from school, which is not something that we can argue with, basically, because it's a statutory definition. And in terms of Councillor Fitzpatrick's just remark, clearly, the administration will do the best it can to support children's services in whatever way. And it's not going to be an easy budget round, but we will hang on in there. Thank you, Chair.
Thank you, Councillor Cuthbertson. And I think everyone around this table could agree that there is not enough money in the system, and it would be great if there was more, and if only people were listening to people like us. But there you go. Okay, thank you. Unless anyone's got any further questions on item 6, I will just say that Q2 is coming back to us in January. And I think in terms of the pressures on children's services, I think when we talk about item 5, about the demographic of the children that we're looking after and supporting, you can see what the changes there that are then directly linked to that budget. So thank you, and I'll thank you, Richard. Thank you for your time. And now we'll move quickly back to item 3. And just to say on this that the agenda supplement that was missed off, which was basically a one-page covering report saying there's a children's safeguarding partnership report, was missed off, but you should have it in front of you. For this item, we have got Michael Melvin in the room, who is Director of Safeguarding. We've got Maxine Squire, who's in Education and Skills. And I hope on the line we have Dr. Maggie Atkinson. Maggie, can you hear us?
I can. Am I audible?
You are audible.
Thank you.
Maggie, if you could just firstly thank you for joining us, and thank you for the work you've been doing and for the report that we have here. I was wondering if you could just sort of introduce yourself, your role, and the report, please.
Thank you, Chair. Good afternoon, councillors, and thank you for having me at this meeting. I speak to you from the 19th floor of a building on the edge of the Olympic Park in East London. The wonders of technology. So yes, my name is Maggie Atkinson, and I'm the independent scrutineer of your multi-agency safeguarding arrangements, your local safeguarding children partnership, which gave new life to its work because local safeguarding children's boards were stood down by the 2017 Children and Social Care Act, and local safeguarding children's partnerships took their place. They are equal partnerships of 3 statutory partners, which is why this is a for information item on your own agendas, and it will be going to the executives and scrutiny organisations of the current clinical commissioning group and the Police, Fire and Crime Commissioner for North Yorkshire, which of course includes the City of York under his jurisdiction. My role as scrutineer is to attend as many executives as I can, to facilitate 2 large partnership days a year, which in the COVID period has been entirely online, and to attend as many of your subgroups as I possibly can, which this report covers their activities as well as the activities of the executive. This report is not solely mine. My materials are in the appendix at the very end, which begins on page 35 and goes through to the end of the report and gives my statutory assurance as your independent scrutineer that the partnership is broadly doing as it ought. The rest of the report is written by those statutory partners, so the City of York Council, the Vale of York CCG, and the representatives of the Police, Fire and Crime Commissioner and the Chief Constable of North Yorkshire. What the report tries to do is to summarise in what has been a very difficult year. It covers 20 to 21, which has been entirely within the period of the pandemic. What it tries to do is to summarise for you and to give assurance that work on safeguarding children, young people, families and communities has not stopped. Indeed, as I say in my section of the report, services have done far more than simply to keep children safe. There have been new projects, there have been new training initiatives, there has been a very close eye kept on changes in legislation and changes in guidance. There's been a great and very healthy working relationship across the organisations, and schools and others beyond the CCG, the council and the police service are what's called relevant agencies. So although they're not bound as they were when there was an LSCB, they are still accountable to the partnership. And that's why this material includes quite a lot of reports, quite a lot of copy from the work of those relevant agencies, as well as the 3 statutory partners. The structure of the report is that pages 3 to 8 give you the partners' summaries and reflections on and introductions to the work that's gone on. Page 9 to 34 gives you what the subgroups have been doing, what the themes are that have been pursued throughout the year, what the records are of what's been done and what's been achieved, how many people have been trained and in what. And then from page 35 to the end of the report, you'll find my section. My advice to you as scrutineers, and this is going to be my closing remark before, if you wish, Chair, I can stay to take questions and that's not a problem. My advice to you as scrutineers is that because you have the power to call in any and all of those organisations under your scrutiny umbrella, you do exercise that power. A great deal of work has been done. The partnership is a partnership of the really willing and of those who will criticise each other when criticism is needed, who will challenge each other when the questions need to be asked, who will celebrate with each other when things are going right. Throughout the COVID epidemic, people have gone above and beyond and are now very tired, but you have the power and the right as a scrutiny committee to call people in and to say, we note what you've been doing, prove to us what the difference is of all this work that's been undertaken in our great city. Prove to us that you are helping to address things like neglect, which 50% of your children and young people who come to the notice of social care have been affected by neglect in some form or another. And remember, that can include psychological, developmental, educational neglect, and it's not just about babies and little children, it's about adolescents. You have a great deal of very rich material in this report that I think you can go through the rest of 21 and into 22 and really drill into what the difference is that's made by all this practice. What's the quality of what's done? Where's the proof of that quality? I think your services are more than ready for those conversations, and not just in the City Council, but in your partner bodies. My section of the report concludes with my assurance to you, as statute requires, that the partnership is set fair and going in the right direction. I would also point out that it raises some of the risks. So changes in very senior personnel, you know, the 3 people who signed off the introduction to this report, Amanda has gone, Annette Anderson has gone, and Michelle Carrington is inevitably distracted by the development of the ICS, as well as doing her day job within the CCG. And so it goes on. You have a new PFCC, you will have new health structures. As you've already noted, the budget is extremely pressurised and may not get better, given that post-pandemic spending is going to be constrained and difficult to sort. it's very, very important that the partners stay around the table, but it's equally important that they prove to you and any other observer or scrutineer that they are doing what they ought to do and making the right differences. I conclude with those remarks, Chair, and I will, with great delight, take questions if people have any. Thank you.
Thank you very much, Maggie. I think that's really, really helpful, and I'll thank you again for the work that you've been doing. And just before we do open it to questions, I was wondering, does other officers, do you have anything to add at all, Michael?
Yeah, I think the breadth of the report and the amount that is in it, I think reflects what Maggie has said there, that the intense amount of work which has gone on through the pandemic on all of the issues, from training and development to Children's Voice to being a learning organisation, and in those different settings. But the challenge is huge going forward, and I think it's right that we need to make sure that we have continuity, that we have as we see personnel changes, and also that we're well sighted on what those challenges are coming out of the pandemic, so that we're there to meet them. So that's pretty much it, I think.
Oh, thank you. Excellent. Okay, unless any other officers have got anything to say, I'll open it to questions. And Councillor Heaton, you seemed raring to go.
Thanks very much. Yeah, more of an open one here, really. When we're looking, and we touched on it really with the conversation about the CCG and the transformation to the ICS model, how is that anticipated to play out? What are the potential issues that could arise? How can that be mitigated, please?
Chair, I have a scrutineer, rightly, and so have the partners, sought assurance from the current CCGs as they move towards being an ICS, that the partnership will continue to have very senior representation. What I'm delighted to report, and I don't know whether members are aware, but I work with your neighbours in North Yorkshire as well as with yourselves in the City of York, and therefore the personnel tend to be overlapping and many of them are the same. I'm delighted to be able to report to you that we have in both partnerships had the strongest possible assurance that there will still be very senior representation at decision-making level and at answerable to their board level of the right people, so chief and deputy chief nurses, designated paediatricians and doctors for safeguarding will still be at the partnership table and held to account and holding others to account for the health and safety of children and young people in your city. One of the things that I think I point out in my section is that the system is under immense pressure. And very particularly, it's under immense pressure in terms of the provision of the right services at the right time for children with emotional, mental and behavioural difficulties who may well present at A&E if they can't get help anywhere else. The mental health crisis has been well documented and well noted, and I know that your services are meeting more and more children and young people with those sorts of difficulties, and that provision is really struggling to keep pace with the demand. And your commissioners are very well aware of that and determined to stay around that partnership table. But the other thing to say is that you have a fantastic opportunity if their determination to make place paramount comes to fruition, because they will plan their services and then work with the provider alliances in York to make sure that place is paramount and to fight back against the Department for Health if needed, if the Department for Health tries to centralise the way that those organisations work. So I think we can be assured, but you're right, Councillor, to raise the issue that you will need to keep your eye on this.
Thank you very much. I think that's just one statement. It is something that's got to be kept an eye on, and it's almost out of the remit of us in terms of how much the Department of Health does look to centralise decision making. I'm aware that that's currently going on in certain areas with the development, so we need to make sure we're staying on top of it.
Thank you, Councillor Heaton. I've got Councillor Fenton and then Councillor Fitzpatrick after that.
Thank you, Chair, and thank you for Maggie for the work that you've done On page 10 of the report, there's a page on systemic practice. And I know it's a theme we've covered in sort of previous discussions at this committee, and there's quite an impressive list of actions that have been taken, training, mentoring, development, to try and embed systemic practice across across all partners. I suppose the question that follows on for me is this having the effect that we want it to have and that we need it to have in terms of ensuring that consistency of approach? I just wondered whether Maggie and our officers could sort of share their thoughts on what they've seen on the back of all of this activity.
Chair, thank you, Councillor, for that question. I think it's a very, very significant one, and one for your continued beady-eyed attention as a scrutiny committee. Because my role in York only covers about 24, 25 days a year, my ability to be with frontline practitioners is limited in the extreme. But you should hold your managers and their teams to account, it seems to me, for doing the right things at the right time with the right children in the right way, in order actually to get, for example, your looked after children numbers down, in order to get children dealt with in the earliest possible fashion by early help, by your universal and targeted services, so that there is less pressure at the very top end of the system. That's what systemic practice is supposed to be about. It's do with the family, not do to. It's build capacity in the family rather than take children away, if at all possible. But that takes time to turn round. I'm sure Michael may have more detail on this, and that your interim DCS will be on it. It's a great model, systemic practice. It's one of the best, but it needs to be relentlessly pursued. And you have a key role to play as scrutineers in working out whether the quality of the practice that's seen on the ground matches the ambition of the model, and then moves towards saving you money because you're dealing with children earlier, not later. Thank you, Chair.
Thank you, Maggie. Michael, do you want to come in on that?
I'm quite happy to come up, on that. So I think what I've seen since I've come into post is that I'm impressed by the level of quality assurance that there is within the service, particularly around auditing, and then in terms of those audits being able to quality assure those. Yeah. In terms of having an eye on practice, and then that then being fed back into kind of cycle improvement. From a practice perspective, that looks quite good. I guess as Maggie was alluding to, the proof is in the pudding, isn't it, really, in terms of what that then means in terms of outcomes for children. I think that we're starting to see that in terms of some of the numbers around children in care reduce, and some of the good work which is happening around edge of care. But clearly we're still some distance from where we would want to be in that area. And I think so those two focus on the quality assurance, an eye on the figures, but also I think, listening to the voice of children and the experience of families is really essential in terms of making sure that you get that right.
Thank you, Michael. And I think, the auditing process and the quality assurance process was something that was highlighted in the previous inspection as being wanting. So it's good to hear that it is on the up. Councillor Fitzpatrick.
Thank you. Maggie, I'm interested to see on your report, rather, on page 45, we talk about reductions in some areas of work matched by rises in others. And you go on to talk about the increase in family poverty. I think that word poverty is one that we, is overarching in lots of areas, really. Would you think that we are right to be pursuing the work we're doing within this?
Sorry, Maggie, I think we've just got a few conversations going on at your end there. Are you all right?
I'm fine, Chair. I am in a shared area, a UNICEF headquarters. Right, so okay. people are heading out the building. So my apologies. This is an away day, and I couldn't get out of it. So
Sorry about that. Councillor Fitzpatrick.
Yes, I'm talking about your reference here to family poverty to be caused by adults, job losses, uncertainty, etc. We know today that universal credit, the £20 uplift is going and whatever. So that kind of family poverty is going to increase, we would think. So would you think that we are right then in other areas within this committee to be looking at community hubs, to be looking at providing food in school holidays, etc.?
Chair, I would say that whatever you can do to try to level your own playing field in York for families who struggle, you ought to do. From an apolitical standpoint, because of scrutiny, I am apolitical and must be so, and have been in a restricted post environment most of my working life, and therefore you would expect me to be apolitical. The reality of the fact that life is not fair to everybody pertains whoever is in power and whoever runs your city. There will be people who will struggle, and whatever you can do to make their lives better so that their children do better than they have done, it seems to me you ought to do. I come from fairly straitened circumstances in my very young life, and I know that what the community, what faith groups, what voluntary groups, what my dad could grow in the garden, and so on, made my life better than it would otherwise have been. So the more you can do to enable them to look after themselves and their own families, the more you can do to work with your fantastically vibrant volunteer community and your schools and everybody else to keep people afloat in what could be a very difficult winter, and then on into next year, you really ought to do. But also remember that there will be a 21 to 22 annual report of the partnership, and then a 22 to 23 annual report. So your partnership can also help you to keep an eye on how safe children are in what could be difficult circumstances for some families. Thank you, Chair.
Thank you. And can I say that it was interesting equally to hear you talk about neglect and the numbers we're talking about there as well, really. So, yes, thank you for that answer.
Thank you. And yeah, I think the fact we're talking about this on the day that they're taking £20 out of universal credit is quite potent, really, isn't it? Just a few questions from me, Maggie, if you don't mind. On page 22 and 23 of the report, it talks about North Yorkshire and the City of York Trusted Relationships Project. And I was wondering if you could just give a little bit more detail about what that is. Who are these trusted people? And then on page 23, it talks about risk reduction. And whilst it does admit that it is relatively early to report on longer term outcomes, I was just wondering if you could sort of explain how this confirms risk reduction and talk a little bit about that as well. Thank you.
Thank you, Chair. You're in the sections of the report that were actually constructed by some of your officers and the police service and others. So it may be that my knowledge of this is fairly headline, but my understanding is that the two authorities have worked fairly powerfully together to look very particularly at children and young people who would potentially not trust figures of authority and organisations representing authority, to enable them better to put their trust in those organisations so that they don't fall victim to the worst manifestations of grooming and or exploitation of whatever sort, whether it's radicalisation or sexual abuse or gun running or county lines or whatever. And that trusted relationship work has been multi-agency. It's worked across all of the footprint of the former county and the police and fire and rescue services footprints. And what it's trying to do, and early signs are that it's been very successful, is because children and young people are prepared to trust, they disclose earlier than they might have done where their lives are particularly troubled and where they might otherwise get into trouble with the law or other organisations, so that services can get round them in a circle of support and make sure that their lives go in the right direction. It's possible that Michael and or Maxine would know more about this. And as you said in your opening remarks, these are early days. So you can probably expect that the 21 to 22 report goes into a great deal more detail and could have data to share with you. Thank you, Chair.
Thank you. Michael, you want to come in on this?
Yeah, I don't have a huge more to add to it, but just to say it's a really live issue. So some of the children with most complex needs who we are concerned about, the issue of trusted relationship work's often raised and often seen as one of the potential solutions to enable those children and young people to help them be safer, and where things are escalating, to have the route to be able to disclose that. So it's something which exists, well outside the report in terms of a solution which practitioners use and see the value in, and which we see the results in some of the children who we support, even those with quite complex needs.
Thank you. Just a couple more from me, and then I'll let you head off. So I suppose my next question is on page 27, and about halfway down, it talks about learning and actions from reviews by CYSCP. And there's a point about sudden unexpected death in infancy, and about how there's a need for the reiteration of messages about prevention of sudden unexpected death in infancy. I was wondering if you could just outline who is it that requires those messages? Who are we talking to? Or, sorry, who do we need to be talking to there that we're possibly not doing enough of right now?
There's a great deal of work already ongoing, Councillor, and I'm pleased to assure you of that. A great deal of it is with midwifery and early childhood health services like health visitors on things like what to do when a child is put to bed. How safe is the sleeping area? How warm is it? How cold is it? Are they properly ventilated? Are they properly looked after? Are they lying on their backs? And so on. But also, how do you keep them safe? So there's been a national set of issues around, particularly during the pandemic, particularly very young parents who are maybe first-time parents who've seen too few professionals face-to-face because of social distancing and so on, and who may well be struggling enormously with a very young baby who's weeping all the time or crying or screaming, who don't know how properly to parent or to hold, or not to shake or to feed. And all of those things are really, really necessary when you're a first-time parent or a parent who's struggling. And the notion of children and young people being harmed or potentially dying in their sleep completely unexpectedly is weighing on the national mind at the moment. And there are reports from the National Panel on Safeguarding Reviews that have said so. And it is an issue in both York and any other partnership where I have contact. But people are on it, is what I would say, to use the vernacular. There are fantastic campaigns running that are led by midwifery and health visiting services, and then carried on through the 0 to 19 services, both in schools and in communities. Very, very sadly, there will always be a small number of children and young people who don't make it through childhood. And sometimes that can be traced, and you can do something about either a perpetrator who's hurt that child or parents who failed. But sometimes it is simply very sudden and entirely unexpected, and equally tragic. And what the community services are doing is gathering around those families and gathering around expectant parents, dads included, to try to make sure that babies come into the world and are still here to reach adulthood. It's not easy, and some of the territory is very upsetting and very tragic, but you have very dedicated staff who work preventatively where they can with parents who are expecting their baby, as well as when that baby first arrives. The pandemic has not made things any easier, but we think that as we come out of it, those services will really come into their own. Thank you, Chair.
Thank you, Maggie, and I think you're spot on. So it is tragic, it's awful, but it is absolutely wonderful that we've got so many good people working on this, and I think it's worth thanking those people for the support they're giving to families. And I'm glad that you did mention dads as well, because I think it is really important to think about that. Councillor Heaton, did you have a follow-up on that?
Yeah, just a very quick one, please. So obviously we're looking at frontline figures there, but I'm assuming at the same time as that there's significant research going on in the background, whether it's expert research, academic, medical. How effectively is that being fed into those frontline staff in order to support them?
Chair, I can reassure the councillor that your training efforts, both across the partnership and in individual agencies, are actually based on exactly the sort of research that the councillor has just mentioned. You obviously, medicine in particular, at all clinical levels, is a very, very strongly research-based profession, as is social care, as increasingly is early education. So campaigns like the first 1001 days, campaigns like ICON, which is based on the fact that babies will cry and you can cope, and here are some mechanisms for trying to cope. All of that is based on very strong research evidence, both from the UK and internationally. And it is fed directly down to the front line, and is also, it features in supervision, in clinical supervision and in professional supervision in each of those professions. And the figures, where there are figures, are starting to come back into the partnership for ongoing discussion. Thank you, Chair.
Thank you for that. Okay, I've got one final question, and this links sort of directly to your annex in the report. And it is sort of the additional risks or issues that will still need to be dealt with. And one of those you've highlighted, as you have already mentioned this, is the concerns around, particularly from our point of view, from the City of York Council, we are losing our Director of People, and we are losing our Director of Children's Services at pretty much the same time. And whilst I have absolute faith in Michael, is going to take on this role of safeguarding and work hard at that, we're going to have new people fitting into those roles. And the other part that you have raised is the fact that we have moved from a specific children's focus to we have a more broader people directorate now, and this is something where Michael, this obviously does impact on your role and roles you've done previously. Maggie, I was wondering if you could just comment in a bit more detail about sort of potential mitigations that you think we should be looking at in your, and then I'll ask Michael to comment as well. Thanks.
Thank you, Chair. Obviously, it's far be it from me to tell you how to structure your staffing. However, if you are going to have a twin hatter, which Amanda has been, then my very strong advice would be you need to make sure you have an extremely strong structure and staffing tree underneath that person to take on both children and adults with the full span of everything that comes with those two roles rolled into one. That person needs an incredibly strong team underneath them. In Michael, in Sophie's replacement, which I know you're interviewing for because I've been asked to put time in my diary to help, in Maxine's role, and in the roles that come then immediately under them. If you were to decide to go back to separate DAS and DCS, that would be entirely down to you, but they are both statutory roles, as you know, as are the lead members who support them. So there is a great deal weighing on those people. They are, four of them, the only roles in local government that are described in statutory guidance. Lead members, adults, children, DCS, DAS. So whoever comes into those roles, and York is a very attractive city to work in, and I'm sure you will find a field of applicants. My advice, pay what the market will bear, get the very best people in you can possibly get. Rejoice in the fact that both Amanda and Sophie are going on to developmental positions in other authorities and carrying what they've learned in York and what York has taught them into those new roles. But be aware that you need the very highest calibre of people you can get to deal with the onslaught of challenges that are coming in everybody's direction if they work with children or adults in local government and in partnerships. These are not easy roles. Thank you, Chair.
No, thank you, Maggie. And I think you've highlighted the concerns that I know a number of us have shared over time. Michael.
Yeah, I would not disagree with anything which Maggie said there. I think in terms of the approach which we're taking, I'm confident we have Anne Coyle now, who started as an interim director of Children's Services, and she started before Amanda's left, and there is handover, and that continuity is being maintained. And myself and Jamila and Maxine are within that team as well. And I would agree as well that you know the structure needs to be robust, and it feels as though it is. We have a corporate director that's a twin hatter. I sit with a portfolio across both, and then we have distinct assistant directors covering children's and adults. It is just making sure, to my mind, that we keep the continuity going so that we can build on the real progress which has been made while Amanda's been here and Sophie's been here. And I'm confident that we're going to do it. I don't want to say too much about the recruitment process, but I'm confident, certainly in the assistant director, that we'll make a good appointment.
Thank you. And I just want to put it on record, I've got absolute confidence that everyone's got their hearts in the right places, and we're all determined to do the best for children, young people and adults, but it is looking at the stresses on those roles. I've seen that Councillor Cuthbertson's indicated. I was going to ask, as you know, executive member for Children's, what are your thoughts on this?
Thank you, Chair. I thought you were going to say you were going to ask me an awkward question then. But,
that comes later.
I think it would be easy to be premature and say how much confidence we've got in everybody involved. But I think perhaps I could remind this body that over the last 2 and a bit years, Amanda in particular has been responsible for some quite marked changes in the organisation and the approach of children's social services. And Sophie has been an equal, if I said that they sometimes appear to be joined at the hip, apart from the fact that they're usually in different rooms, that's often the impression I get from them. I'm content that in the case of the chaotic labour market that we find ourselves in, and we found ourselves increasingly in over the last, certainly the last year and a half, if not 2 years, then if a plum job in possibly a slightly better funded authority with perhaps access to a wider range of resources comes up, then it would be a temptation that any director might find it hard to resist. And what I can say to you is that Amanda has given wholeheartedly of her time, her efforts, and her resources to lead and direct the department. What I do know is that following an Ofsted report of 2018 and 19, that there's been an enormous amount of work done within the department to address the shortcomings that were identified in that report. And as far as I'm aware, both Ofsted and the DFE are in touch with what's been done, particularly on the special needs side, but more widely across the department, particularly in terms of introducing the MASH and the systemic practice approach within the whole social work department. And they are on side with that. I don't know that we can expect a brilliant Ofsted result when they turn up, but my hope is that, based on what both Sophie and Amanda have said to me, it should be at least a grade up from where we were, or where we might have been. I think that's as much as I can say without being a practitioner myself. But I have met Anne Coyle. I had a 3-way conversation with Amanda yesterday. Seems like a long time ago now, but it was actually very impressive. She seemed to be ready to hit the ground running. The relationship between her and Amanda was a very positive one for such an early stage in a handover. And although Amanda won't be with us for long, I feel confident that Anne will take up this baton and run with it and hopefully help us to produce a good result at the end of the race. I don't think I can say more than that. Thank you.
Thank you, Councillor Cuthbertson. And yes, I also hope that people hit the ground running, because I do think it is a huge concern. But it would be ideal to sort of get an inspection in some way, shape, or form in quite soon, because I think it would be good to have that, evidence of what has happened and what needs to happen next for this new person. And us as an authority. Councillor Fitzpatrick, you want to come in on this?
Well, I won't say much really, because I think you've just more or less said it, Councillor Webb, except to say that I would agree from what I've heard and read, that we have made a good appointment in Amanda's replacement. So we will wait and see. And absolutely, we do need to have Ofsted as soon as possible, and preferably in this handover period, really. That would be particularly good. It would give us a benchmark to know exactly where we need to move on from. And where we're going. So, the sooner the better, really, for Ofsted, I think.
God, I never thought I'd be looking forward to Ofsted. Oh dear, we've come a long way. Okay, does anybody else have any further questions, comments, points to make? Wonderful. Okay, Maggie, thank you very, very much for your report and for your great knowledge and great support there. And I think we can let you get off and enjoy London, whatever it is you're doing. Okay.
Thank you very much. I'm still working. Good night, everybody. Thank you.
Well, get back to it then. Thank you very much. See you later. Bye-bye. Members, we've been going just under an hour now, and we've got coming next item 4. Am I right? Yes, item 4, safeguarding in schools, and then item 5, profile of children and young people in care. And I was wondering if we could possibly just take a 5-minute break and then come back for the last hour. Does that seem to be reasonable to everybody? Lovely, then that's what we'll do. 5 minutes, and we'll be starting again at 6:30. Thank you. Bye. Okay, folks. Hope we're all well. We're all back. For all those thousands of people watching us, hope you've come back to us. We now move on to item 4 on the agenda, which is safeguarding in schools update. I would imagine that Maxine Squire, our Assistant Director in Education Skills, would like to introduce this report. So Maxine, over to you.
Thank you, Chair. And I also would like to deliver an apology from my colleague, Caroline Wood, who has written this report and did want to be at Scrutiny this evening, but she's actually delivering safeguarding training in a school as I speak this evening. So it's a very active demonstration of the work that she's doing through this update. We're very fortunate in having a dedicated school safeguarding advisor role within Education and Skills. And as you can see from the reports, Caroline works across all our schools, including academies, schools and our FE colleges. Her support is very comprehensive in that she keeps all of those institutions up to date with the latest advice and guidance from the DfE around keeping children safe in education. And she works very closely across the multi-agency partners within the City of York Safeguarding Partnership. She's a member of the subgroups, and she also acts as an education link for the MASH. So she has a very wide-ranging role in terms of the work that she does. She also as well provides support in following up on notifications that we receive from Ofsted, where parents have directly contacted them about concerns relating to safeguarding. Many of those concerns during the year are very often related to concerns that parents may have about bullying in schools. Each one of those notifications is followed up by ourselves, and we seek assurance from the schools in terms of the work that they do in response to the complaints that are received. And we get back to Ofsted to provide them with reports and assurance about the way in which we work with schools to develop the work that they're doing in response to any of those complaints that we receive. Our school safeguarding advisor works very closely with our school inclusion advisor and also with our early years inclusion advisor. So she provides support as well to early years settings where they're requiring extra advice and guidance in their safeguarding role. The training is very comprehensive, so she provides safer recruitment training to governing bodies and to school leadership teams. And as I said, she provides those regular updates in terms of any changes from the DfE around safeguarding guidance. She's been very active throughout the pandemic. So she's provided both face-to-face and online training and support to our schools. And there's very good engagement from them with the training that she provides. She's also been supporting schools with the rollout of various pieces of multi-agency training, including the work that's gone on to promote training around harmful sexual behaviour, which is referenced in the annual safeguarding report. And she's been responsible for working with partners on some specific work around social media and how to keep children and young people safe in that environment. That work has been done in partnership with schools and has been trialled by a number of our secondary schools. And it was launched during the Safeguarding Week in June. I think the impact of her work can be demonstrated through the fact that when schools are inspected, we have had no occasions of schools being inspected by Ofsted and being found inadequate for their safeguarding procedures. And that's largely as a result of the fact that Caroline provides an external assurance of school safeguarding procedures by working with them to ensure that they are implementing all the correct procedures around safeguarding. So we can really evidence the impact of the work that Caroline undertakes. She offers safeguarding reviews to all schools and settings, and is very busy during the year in terms of the work that she is doing. And as I say, that's also evidenced by the fact that she's not able to attend this evening because she's actually conducting that work at the moment. So I'll leave it there and invite any questions.
Thank you, Maxine. Sounds like Caroline planned this, but yes, that's really helpful. Members, questions? Councillor Fitzpatrick.
Thank you again for this, Maxine. It's very helpful. Just a couple of things really in light of actually what you were saying. I mean, it is quite impressive that we're saying that all schools sign up to this. What is the expectation? I mean, given the difference with academies and, you know, the remaining, you know, reduced number of schools that we have, that's a choice thing. Is it for them to liaise with us on that, or
no?
They've got to do it.
Yeah. In terms of the statutory role of the Director of Children's Services, obviously that's a twin hatter role as well, because they have responsibility for children's services, but they also have responsibilities under the Education Act for the statutory aspects of education in the local area. And one of those statutory responsibilities is ensuring that children are safe in education. So that covers all schools, regardless of their designation. So that covers independent schools, as well as the academies, the state-funded academies. And there is a requirement for us to keep that education overview of the welfare and safety of children in all education settings. So there is a requirement for them to cooperate with the local authority around the safeguarding of children and young people.
Thank you. And one other question, if I may. I was interested that you talked about early years, obviously, and going down. I missed the committee that Councillor Cuthbertson might remember the name of. I can't remember it now. Maybe Councillor Webb knows. The one when I was in your role, Councillor Webb, I went to, where we would meet school nurses, we would meet people who dealt with the very early years, midwives, etc. It was a kind of multi-agency meeting. So we would know then, we've heard Maggie talk earlier about midwives, about health visitors, about getting in early. How far, maybe Michael would know as well, how far down do we go? I mean, how young, I suppose, is what I'm saying, in terms of do we go before they actually arrive at school, given that, you know, it used to be that you didn't have to send your child to school till they were actually 5. You didn't have to engage with early years if you didn't want to, you know, those sorts of things. The links are there right the way down, are they, Michael?
Yeah, so safeguarding duty extends to all children from birth, and so some of that is delivered through you know, members of the partnership, and some of it is through our own kind of statutory intervention. But yes, yeah, it extends from birth onwards. Yeah.
Thank you.
Actually, pre-birth, if there's a concern, that's right. Yeah, if it's been flagged through maternity services that there's a risk within a family, then they would be looked at pre-birth as well.
Councillor Fenton, was it on this point? No, okay. I am going to go to Councillor Cuthbertson, who seemed to indicate on this point.
Thank you, Chair. I'm sorry I missed a bit of that. My hearing doesn't handle the length and the acoustics of this
Councillor
room.
Cuthbertson, I think Councillor Fitzpatrick was referring to the Euro K board,
Yes.
the Children's Partnership,
Right,
which I
okay.
know you're doing some work on at the moment.
Well, in terms of what was the Euro K board, we are working to assemble a replacement for it. It's not going to be called son or daughter of Euro K board, but it will, as far as we can make it, address the areas that Euro K board covered. What I wanted to say there was that over the last couple of years, we've developed a couple of projects which bring the focus of early years thinking towards the child at home before it gets anywhere near school, before it has its 2-year health check. And if you've heard of the NSPCC's Look, Say, Sing, Play project, then that's something that we're, pandemic permitting, hoping to move forward on in York. And there's also an Early Talk for York project, which aims to give children an early acquisition of speech and language, so that by the time they get to school, they won't have, if you like, the social barriers and the communication barriers that they would have if they didn't have some help from their family, some help from a speech therapist, wherever that help can be given. And the idea is that by the time they come to the end of year 1 and have their first year development level test, then a greater percentage of children will have a good level of development, which is something that we particularly found problematic in York over the last few years. That bodes better then for bringing them into the mainstream education system with those communication skills and listening and, if you like, respect for other people's skills already embedded, which we hope will not only help with primary education, but also with secondary education. And who knows, universities as well. But it's not unimportant, and I'm sorry that it's only peripheral to the committee that Councillor Fitzpatrick's just mentioned, but funnily enough, it was mentioned at that committee before it had its last meeting, I think in March of 2020. Sorry, is that right? 2020, yeah. So who knows? We might be able to support that project, which is ongoing, in an even more determined way. Thank you.
Thank you, Councillor Cuthbertson. Yes, we're very aware of that project, and the opposition tried to expand its funding last year and you shot us down. But anyway, let's leave that there, because I do think it's something that's very valuable, and I think it would support longer term goals, and I agree. I think it would help with further up the school. Maxine, you want to come back on that?
Yeah, Chair, I just wanted to add as well that the work that we're doing at the moment in the early years with an innovation partner, Nesta, is also ensuring that children are seen by agencies. So one of the things that we've done through the discovery stage of that project is increased engagement with the 2-year-old health check. And we're building on that to ensure that the barriers that parents see to engagement with agencies are broken down in those first early stages of life. So that both the take-up of the 2-year-old entitlements is maximised, because that's hugely important to child development, but also that the integrated 2-year-old check is rolled out to all children and families. And the early feedback from that Discovery Pod project is very, very encouraging, and we're now moving into a 3 to 5 year partnership with Nesta to take that forward.
Thank you. And it goes back to that trust thing again, doesn't it? It's trusted relationships. Councillor Fitzpatrick, do you want to come back on this point?
I'm just curious to know, supposing a family, transient family might move around quite a lot for whatever reason, and they moved into the authority or moved into York, how would you know that? I mean, or which agency might be first on the scene? Say it was an 18-month-old baby, or under 2 years possibly. How would that first be picked up if they just moved into the area? Would it be through, maybe if they tried to register with a GP, or how would that be? Could it be, I suppose, alternatively, that a child could go unknown, under the radar?
That's what we're seeking to prevent, to be honest, through the fact that we are encouraging this much more joined up way of working that also involves the community themselves. So as you know, Rob Newton has presented to you on numerous occasions about the work that he's been doing across that early years multi-agency partnership. The element that we are now looking to expand as part of that is the community champions in the early years. So who in the community actually knows about those new families coming in, and are they then actively helping to signpost them towards the help that there is. So, you know, just someone in the community who just says, you know, I've noticed you've moved in recently. Are you registered with a GP? It's those types of things that will start to develop out of the community and family hub approach. And I know that's one of the things that Rob's been working on with our colleagues in family learning, to look at how we can develop that community champion approach.
Sorry,
you're
I'm a
looking
nuisance.
pensive.
I am a nuisance.
Go for it.
Can I just say on that though, given the housing demands, I suppose, in the private sector, given that there isn't the housing out there that people might need that would encourage a family to be stable and stay in one house, if they're renting privately 6 months and then moving and whatever else, that community model might not necessarily be as effective maybe as we might want it to be if the housing needs aren't met really for families with young children. I suppose I'm saying something that we would all agree with anyway, wouldn't we?
Everyone seems to be nodding sadly, to be honest. Thank you. And I think it's maybe something to make note of for our community hubs, sub-scrutiny, actually, as that community champions idea. Councillor Fenton, you've waited patiently.
That's quite right. Thank you, Chair, and thank you, Maxine. I suppose reading the report and looking at the scope of work that one person seems to be doing, do you anticipate an increase in demand from schools, not necessarily for the training which can be scheduled, but the reactive request for support, given everything else we've heard in terms of the challenges that are with us now and potentially coming down the track? What are you anticipating in terms of the likely demand from schools for continued support on safeguarding issues and how we might, you know, work with them to fulfil that need?
As Caroline's highlighted in her report, although she is very, very busy and she holds that single responsibility as a school safeguarding advisor, she works in a broader team of people, all of whom work around the school agenda. So she works obviously with the school attendance advisor, with the school inclusion advisor, and also with the other colleagues in our school effectiveness and achievement teams. All of them understand their statutory duties towards safeguarding in education, and what we would all of us do is signpost towards the broader multi-agency partnership, and particularly where it's important for schools to refer into the mesh, for example. Yes, Caroline is very busy. We're always thinking about succession planning in a very small team, and how those skills are kept live. But she's very much views herself as part of a broader team as well. So what we are also very, very conscious of is the pressures that exist within our schools and within our designated safeguarding leads, and trying to ensure that they know where to go to when they're needing additional support and information.
Thank you. I've just got one question, Maxine, regarding the multi-agency safeguarding hub and its links with schools. And it was more just a sort of a general question about what sort of feedback are we getting from schools about this new setup and how it works, and positives and negatives.
Schools are seeing improvements, definitely. They've welcomed things like the threshold documents. They've felt that there has been a change in terms of the culture within the way that things are done. As you know, because you work in a school council or whatever, you know, sort of schools always feel that they need more in terms of proactive support. And I don't think there'd be a head teacher in the city at the moment who wouldn't say that they are seeing increasing complexity in the communities that they serve. They are seeing some young people who are bringing challenges that have probably not been at a level that York schools have seen for quite a while. And that is something that they are concerned about, that that many of them have invested heavily in building their pastoral teams as a result of the pandemic. Yeah, I think it's an area that we constantly need to be working on. How do we make that team around the school ever more effective? And I know it's something that my school inclusion advisor, Dan Bodie, has been working really, really hard on in the last year. And I do think there are opportunities as we move through into the coming months to think very carefully about some of the models that we can see are being well evaluated nationally, like the embedded model of social workers in schools, which is making a real difference in some of the London boroughs. And I think that is something that could be an area that we want to look at developing in York, because what we've learned during the pandemic is having Sophie sitting in YSAB at certain points made a huge difference. The work that Effectiveness and Achievement have done around attendance and working with the social care teams around that has made a huge difference. So we want to encourage that more joined up working, that multi-agency response in the way that we work around the schools.
Thank you. And yes, I think schools do need more, but I would say that, as you pointed out. Councillor Heaton, you wanted to come in on that.
Yeah, thanks very much. So we're obviously looking at models, and we talked about schools wanting more. Have they expressed any sort of like particular specifics that they want us to be looking at?
Yeah, I think where schools would want more help is where they've got very complex issues coming in linked to things that are not in their direct sphere of influence. So it's where they've got problems that have come in from the community, problems that have come in from family circumstances. Their pastoral teams can do so much, but their reach is limited as schools. Yes, they see children every day. They are very attuned to where they're seeing early indications of problems within a family, but they also know that there are some things that they are not the right experts to be working with, and that's where they need to be supported by a broader team of people who can work with them. So, for example, some of the attendance issues that schools are grappling with are to do with circumstances within families, which require the school to be supported by mental health professionals, where it may be linked to maternal mental health. The mum can't get up and she can't get the child into school. It may be that the school is grappling with issues where they need to be working with the police in a very, very targeted way around an early intervention. It may be that they need support from youth justice. There are various things that schools working in that arena, they know the skills that they have, which are about supporting the child through their pastoral systems, through the work that they do on teaching and learning. But there are some issues that the child brings into school which are more complex than somebody who's trained in teaching can actually deal with. And I think that's where we need that group of people who bring multidisciplinary skills that are actually needed around that team around the school approach.
Thank you, Maxine. I think it's true to say, what's the old phrase? It takes a village to raise a child. I think it takes a lot of different people, doesn't it? Okay, thank you again, Maxine, for that update. And I think what we'll do now is we'll move on to our final item on the agenda, which is item 5. Just before I do that, because I'll forget if I don't, we have now received apologies from Councillor Barker. So apologies, Councillor Barker, wherever you are, but I didn't mention that sooner. So anyway, item 5. And Michael, Melvin, you are going to introduce this item for us. So off you go.
Yeah, so this is a report on children and young people in care. It's prepared by Sophie Wales, so I'm very grateful to the work she's put into that. And unfortunately, she can't be here this evening, so I'm presenting this. So it's for information, really, and it's an update about our children in care. And I guess it matters because we are the corporate parents of these children. And so understanding the work which we're doing and how we're supporting them, it's really, really crucial. So I'm very pleased to be here and discuss it. And we've heard this evening in a number of reports that, 2018, there was a lot of concern about practice and decision making in social care, and that was confirmed in terms of what Ofsted told us as well. And as a result of that, there has been a lot of investment in practice and assurance around decision making and systems in place to try and ensure we do the right thing. And initially, what that resulted in was an increase in children in placements as we dealt with some of the issues of drift and delay and concern about child protection plans, and made decisions on a safety basis to move children into the care of the local authority. I think what this report does is it shows how that corner's been turned, really, in terms of now reducing children in care. And that's really as a positive result of the good work which is going on both to prevent children needing to come into care and also work in areas around discharge, such as adoption, special guardianship, and other areas, so that we can safely see that children in care population come down. There's quite a bit of detail in the report in terms of the types of orders which we have, the circumstances children are in, as well as the demography around ages of children. So I'll take you through a little bit of that. In terms of orders through the court around placements with parents, we tend to do this, where we're very, very sure that this is okay and it's safe. And it's an order which is often made by the court and not a decision which obviously we take alone. And is sometimes used when we've come with various other options. The number which we have in these circumstances is it's relatively high historically for York, but it's stable, declining slightly in terms of new orders. And I think that is probably around the growing relationship between the department and the court and guardians in terms of the proposals which we bring. And also the work where the circumstances in which we'll suggest that as an option for the court, where we think, particularly with older children, there is a real opportunity around, permanently that placement with parents working out and continuing. And you see that around some of the figures for our older children. There's information in there around our Section 20 arrangements. So that's the voluntary agreements which we have with parents around placing children. And those are reviewed on a voluntary basis with those parents. And again, what we're very keen is that we don't see any drift in those circumstances. And members will see in the paper that the number of adoptions which we're seeing from this area is doing really, really well. And that reflects the really good regional approach that we have to adoption and how we use that regional framework to its best effect. so that we are, we're on track and above where our trajectory needs to be in terms of adoption. And also, you'll see from the paper around timeliness and the timeliness measures around adoption that they are significantly better than they used to be and compare relatively well with national comparisons and indicators. You'll see from that we have the number of cases that we've got in care proceedings is down considerably. So that's the kind of the sort of the new entrant element. And again, I think that's an indication of a successful sort of recalibration where we're trying to make sure that the numbers come down, but they come down safely. I think what isn't in the report is that that's in a context which sort of bucks the trend of most other local authorities who are seeing numbers in care increase through the pandemic. So it really is an extremely positive picture. And I think part of that is the work which is being done, again, which has been alluded to this evening, around work on pre-court proceedings, where we're intervening with families, particularly using systemic practice to make sure that we build relationships with the families in order to we can intervene to make sure that we don't need to end up in care proceedings. I think that's borne out in those figures. Where we have intervened and where we've gone to court and we have children in care, obviously kind of finding permanence and doing that in a timely way is extremely important. And you'll see from the paper, there's some assurance there that we track that really effectively with the use of permanence tracker. And that's really about preventing delay in the system and making sure that that permanent solution for that child, that they have the right home, happens quickly. And we'll also see within there that there's a positive story in terms of the numbers of children who, the number of moves that children have, and the children not having to move, the numbers moving, kind of 3 times or more, being significantly lower. And so that feels like that's headed in the right direction as well. I think other bits which I probably want to draw your attention to is things around special guardianship. So there's been a real push around special guardianship as well. So that's where we're working with connected carers so that they're able to take on the role of parents of those children without any kind of detriment which they would have if we didn't have those arrangements in place. And that helps normalise the situation and move it out of the kind of children in care setting. Placements and out of area placements. We have a number of placements which are outside of York, but generally they are within that 20-mile radius. So that's reasonably positive, and it helps children maintain those relationships. And the placements which we do have outside of York, the majority of those are with connected carers, relatives, but there are a small number of children who we are considerably concerned about where we do have residential placements, and those are outside of the city. And obviously that's something which we are extremely concerned about. And the Assistant Director has a standing group which looks just at those children and the planning which goes on to bring those children back. And again, that very small number, some of them are in circumstances of unregulated placements. And in those circumstances, all of those we bring to court so that the inherent jurisdiction of the court is used to authorise those placements where we're able to demonstrate that those placements are the right thing for the child. And although if they're unregulated, the safeguards around them are extremely robust. So that is an area of considerable work which is going on and links to the development of our own children's homes and making sure that we have the ability to look after children with the most complex needs in York. Within the paper, there's a number of kind of what needs to happen next issues. And I think probably we'd add to those that we really do need to make sure that our recruitment of foster carers is as good as it can be, and that the support around foster carers is really good. And that we're able to make sure that we keep children local, so it's those numbers which go outside. So I think there is some really positive stories which come out of the data there. There's clearly work still to be done. I'm very happy to answer the questions I can in terms of the report. There may be some areas which I do go back to Sophie as the author, or even potentially Anne in a new role might want to get involved as well.
Thank you, Michael. And firstly, I think you've been reading my notes. The S20 and end of order PWPRS, they were things that it's good to have. Whenever there's children involved, we seem to have about 1 million acronyms and very complicated choice of phrasing. So I'm glad you explained those two. And members, if there are any others you spot where you look and you go, I have no idea what it is, feel free to highlight it. Members, Councillor Fitzpatrick, you had your hand up first.
Yes, thank you, Michael. The out-of-county placements really have always been an issue, haven't they? And it's the key question. We would always want to know how many and how much do they cost. And they're usually things that most local authorities try and avoid giving direct answers on because they are very expensive. So that's a comment really. I'm glad that you've talked about that, and that will be something that we will always want to keep coming back to. How many 52-week placements, for example, how many education and care together placements, the monitoring of those schools or placements, who checks, I mean, the links there, obviously if it's care, it'll be a social worker. I've taught at one point in my life in a school like this, and it was always worrying that some local authorities didn't come and visit really as often as they ought to have done, to check that the curriculum was right, to see what they were learning, that sort of thing. I mean, I'm looking at Maxine there. So that, but the question I suppose really that I do want to ask, there's a few of us here who are on the corporate parenting board, and the arrangements for that, as you know, are changing, and quite rightly so that young people will be a lot more involved in that. That's fine. So this will be the forum then, will it be, for those of us that might not be on that board anymore? This will be the forum to ask questions that we would normally have asked of the exec member or yourself about those arrangements, because it's crucial. I mean, and we did say the other night at the, well, certainly I said it, that, you know, it's safeguarding. It is so important. And it's, whilst it is important to have the young people running their own affairs at those meetings, it's still the scrutiny, really.
Yeah, so I'd say absolutely in terms of scrutiny. I think you heard it very much from Maggie as well, didn't we? That you know, the being able to bring the local authority here, myself, other senior officers, to talk about what's happening, be it with out-of-county placements or what we're doing around prevention and or edge of care, but also some of our other partners in terms of the contribution which they're making to safeguarding children. So yeah, I'm very happy to you know, to be here, but also to have conversations out of the formal meeting if there's things which you know, members want to discuss about, you know, what we want to get here and how we want to bring it here. Because you're right, there needs to be a place where we can have those conversations.
Thank you, Councillor Heaton.
Thanks. Just looking at point 9, where we're looking at number of cases in proceedings, where we're looking at improvements in those areas. And we've spoken about this before, in this committee. What's the impact from a position of finance, I suppose, in terms of reducing those number of cases and making sure we're actually getting cases through in an appropriate time?
Yeah. So the 2019-2020, I guess, sees that kind of kind of peak where we've sort of tried to recalibrate the system, and we've got to have children going through proceedings. We're kind of that bulge feels certainly it's kind of starting to work its through the system. And we can see that just in terms of some of the statistics later in the paper around the number of care orders that we have. I guess in terms of what that means in terms of the budget is that we're probably at least sort of 30 children in care still over the budget. And my view would be, even if we went down to sort of 240, 230, we'd still have a significant budgetary problem because of the issues of complexity that we've talked about a little here before. So I think we can get significantly closer to a better position in terms of the budget. And there's certainly work to be done around both our internal services. So if we get our own children's homes right, which can work with people with very complex needs, children with very complex needs, we do what we need to do around fostering. All of that helps, but there is still, a real significant budgetary challenge. It is about, that work which happens sort of pre-proceeding and edge of care work as well, which has been significantly invested in, and that systemic practice happening there as well. So I think we're kind of we're over the bulge. I think the things which we're really struggling with are complexity and the cost we pay for those extremely costly placements, and how we achieve better, more permanent solutions for those children closer to home, which actually cost us less and have better outcomes for those children. And the more we're able to do that, the better the budget position will look like.
And in terms of, there's a comment there in the same point about improvements in care planning and evidence. And in terms of making sure that things are going through, we're not receiving any, I don't know whether you describe them as fines, but costs incurred by those things dragging through.
Yeah.
We're seeing an improvement in that direction.
Yeah, absolutely. So there is all of those individual children's progress is tracked through a permanence tracker, which is what are the actions that we need to get to the right solution permanently for that child. But also in terms of there's a legal tracker as well, which is reviewed weekly, just in terms of looking at is there any delay in what we need to do to get through the legal course to the right solution, and that's done on a weekly basis, and there's a monthly senior management meeting which myself and Sophie are at, which views that as well with our legal colleagues. So yeah, there are a lot of people who are all over it, I think.
Yeah, and in terms of capacity within the court system, where are we at the moment? Because obviously, there's been issues with capacity previously. Yeah. Have we seen improvement on that side of things from that perspective?
Yeah, so I think you're right. So that through COVID, that has probably delayed some of what we needed to do in terms of court capacity. But so I don't have the kind of the figures on that. So I'm talking on my kind of recent experience at the meetings which I've chaired around that, and that is not such an issue as it has been in terms of my kind of anecdotal experience, but I can get some figures on that if that would be helpful. That'd be brilliant.
Thank you.
Okay.
Thank you, Michael, and thank you, Councillor Heaton. I know you've raised that question sort of in different forums a few times now, and I think it would be worth getting some more detail on where we are sort of post-pandemic, I guess. Councillor Fenton.
Thank you, Chair, and thank you, Michael. This is probably the most kind of granular level of information we've had as a committee for some time, and it's really, really helpful. You know, particularly in showing that, you know, as a city we're supporting a number of unaccompanied asylum-seeking children. I just wondered whether, looking back over recent years, is this a relatively sort of recent trend, or has there always been a number of unaccompanied asylum-seeking children that we have been supporting? I wondered whether, thinking of sort of recent world events, whether it's a consequence of Afghanistan or goes back further to the influx of Syrian refugees. You're just genuinely interested in how recent a phenomenon this is.
So yes, so the unaccompanied asylum seekers and refugees, we're given an indicative amount which we're expected to take, and that's a national scheme. And in York, we've taken slightly more than what we are supposed to in terms of the target which we've been given. And you're right, the numbers they fluctuate in terms, in relation to world events. So the current situation which we have in Afghanistan and no doubt elsewhere impact on that. Yeah.
Thank you. That's a good question, Councillor Fenton, as well, isn't it? And I think it's absolutely right that we're welcoming these poor children into the city, really. I think it's the right thing to do, and I'm really glad that we can be supporting where we are. Any further questions from anyone else? No? Okay, I've got just a couple myself. And also just say, I think what the interesting about the budget, of course, if we can bring the budget down and we can spend the more money effectively, we always should. But at the end of the day, we have to make sure that we're looking after these children, whatever that number is, whether it's 280 or 290, or it does come back down to a more manageable figure. But my question, I suppose, on page 63 and 64 of the report, you've got the adoption scorecard performance. And the average time in days between a child entering care and moving in with an adoptive family, the A1 national target is 426 days. York's performance is 339 days. So great. Well, that's good. Happy with that. And the other, so you've got the time between entering care and moving in with an adopted family being placed. There's 4 measures here where we've highlighted the averages. But I was wondering, actually, what are the longest times? For example, there are some if we've got one child who's actually waiting 3 or 4 years, that could be a real concern, couldn't it? So I suppose, do we have any details around anything beyond the averages?
So we do, we can get that to you. So I don't have that at my fingertips, but yes, it is collected and it is looked at because we look at because we track it all. We look at every child who was on that, and we look at, as I said before, the process which we need to get through in order to get that child to the permanent solution, and we do that in a way which tries to root out delay. So the outliers on that, I'm very happy to we can give some information on that with why they are outliers. I think that's a really good question which we should answer.
In fairness, Mike, it was a really awkward question of me, and I knew it was when it was coming out of my mouth. But I think it's worth saying that because, you know, we could have some children here who are massively outlying in the situation. It'd be interesting to know both what the maximum is, but also the sort of numbers within those upper quartiles, for example. My other question was around page 59, paragraph 20. And I've read it several times now, and if I'm honest, I just don't really know what it means. The previous paper highlighted a combination of reasons for including the impacts of the recalibration of the safeguarding service and a reluctance within the wider system for children to remain at home without the local authority having parental responsibility. Could you just explain paragraph 20 and what that potentially means? Sorry, I'm being quite cruel here.
That's all right. Yeah. So I guess what that's saying is there's a kind of natural risk averseness in the system, which is possibly, in some respects, no bad thing, because there's a choice of legal mechanisms whereby children could be at home, and the local authority has some involvement and oversight of that. That placement with parent order is the kind of the most intrusive, I guess, because it gives the local authority parental responsibility. So yeah, so what you would expect is that as we work better with the court and with guardians, that there's a more shared sense of risk, and some of this may come down. So it would be a good indicator if it starts to fall, because we're demonstrating to the court that we're able to work well with families without necessarily having to have that more serious level of oversight, if that's helpful.
No, it is, thank you. And I think I share Councillor Fenton's sentiment with this is a very granular report, and it's really what we've been wanting for quite a while, actually. So please pass on our thanks to the authors, but also thanks to you for being able to answer those questions. Members, do we have any more questions or any comments on this item? No? Okay, well, thank you again, Michael. And goes without saying, our thanks to all the people who are working with these young people on a daily basis, whatever their capacity is. I think it's absolutely phenomenal work. Okay, now we're just going to move on to item 7, which is our work plan moving forwards. Now, obviously, we sort of spoke about this work plan last week. I'm not sure if this has been updated. It has. Excellent, brilliant. So essentially, last week we spoke about having sort of more a themed meeting in December that was around the voluntary sector, including visitation from the commissioning director to talk about autism strategy. And we then talked about our January meeting being more about holiday activities and food programme, an update on that, feedback from the community hubs, Scrutiny, which hopefully we should have something interesting to report back by them, plus feeding from the early help via the local area teams, which also fed into the community hubs. So that's sort of the next couple of meetings, and I think that they seem reasonably straightforward. Has anyone got any questions or comments right now? Councillor Fitzpatrick.
In the light of what we're saying about corporate parenting, I suppose depending on how that pans out with the corporate parenting board, that will need to be in somewhere, won't it, to be looked at here at this meeting. That's on the work plan. I mean, I know it gives us one more thing to do, but also really just to say at this point, not on the work plan, but as a kind of training exercise for all elected members, really safeguarding and continually safeguarding, but the role of the corporate parents for all elected members to have a better understanding of, are there plans for that to be rolled out really? I know I'm going off a tangent, but it's relevant to corporate parenting, maybe coming down this route in the future.
Yeah. No, I think that's an absolutely fair point, and so I'll go back and I'll have that discussion and just make sure that we're doing what we need to do in terms of supporting members around their corporate parenting responsibilities.
Thank you. And I think on that vein, I mean, the items that we've had tonight have been, for information, but particularly that last item we've had, it might be good to look at something similar maybe in 6 months' time, a similar report to look at the figures further on. So essentially just an update report on the profile of children and young people in care as item 5, basically. But in 6 months, would that be a reasonable time frame?
Yeah.
Do you think? I think because I do think it's, particularly with the changes to corporate parenting, I think it's probably important that we keep an oversight of that. The only other thing I was going to mention was we do have a couple of unassigned items at the end. So we've got staff absence, sickness rates within the People Directorate. I think it'd possibly be good to put that onto the March forum, because in theory we'll be vaguely over winter, which is where I expect some of the worst sickness and absence problems will be. And hopefully by then we might be ready to identify a clear plan of how we're not going to then repeat those issues further down the line, and also hopefully we'll be further away from pandemic. Does that seem sensible?
Yeah.
And then the other item is the cultural offer, and from Reach, and we've put this off a couple of times, but I was thinking, could that go into the April meeting alongside the Skills and Employment Board and York Learning? Does that seem reasonable for everybody? Just so that they're bedded in somewhere, because originally Reach was meant to come to December, I think it was, but they got full. Happy with that, everybody? Good. Silence is essential. Brilliant. Okay, well, unless anyone has any miraculously urgent business, then I'll thank you all for your attendance, particularly to our officers who've indulged us. Thank you again to Councillor Cuthbertson. Having an executive member here is very helpful. And thank you all and have a good night. Thanks, guys. Bye-bye.